So inspection of the hand needs to be done both on the dorsal and the volar aspect. And so when you're looking for any scars, any atrophy, and any erythema. This is on the dorsal aspect, and then we would move to the palmar or the volar aspect, specifically looking for any atrophy in the median nerve distribution or the ulnar nerve distribution. That would be the inspection portion. Next, we would do purposeful palpation. In purposeful palpation, you're looking for specific structures. On the palmar aspect, you're looking for the ulnar collateral ligament and then the radial collateral ligament. You're looking for the scaphoid bone, and the scaphoid bone is in the anatomical snuff box. You're going to palpate the length of the metacarpals and then the phalanges on each digit all the way there. And then on the dorsal aspect, you're going to again palpate the anatomic snuff box, looking for the scaphoid. You're looking for the radiostyloid and the ulnar styloid. And then finally, the triangular fibrocartilage, which lies on the ulnar aspect, just distal to the ulnar styloid. You've now done inspection, palpation. You're going to do range of motion. Range of motion, you would ask the patient to radially deviate their wrist, then they will ulnarly deviate their wrist. Then you would ask them to extend their wrist, and you would ask them to flex their wrist. And again, you can compare both sides. And then you're going to do the integrity of the thumb and the fingers. The fingers are fairly easy. You're asking them to flex their digits, okay? First, fully making a fist, and then to partially flex their fingers, noting that all digits should roughly point to the scaphoid bone. If there's any rotation of any of the metacarpals, it will be obvious, and they can go ahead and fully extend their fingers. The thumb has some complex range of motion, and so let's go through that. And so this would be thumb flexion, this would be thumb extension, this would be thumb adduction towards the midline, and this would be abduction. So flex your thumb, please. Extend your thumb, please. Then I want you to adduct your thumb, and then I want you to abduct your thumb. And then you would ask them to touch their thumb to each digit. Perfect. And so we've completed inspection, palpation, range of motion, and then we would be doing strength testing. You can individually test all the finger joints and the thumb joints as needed. And then you also want to test the strength of the wrist. And so you would have the patient do flexion, and then you would have the patient try to do wrist extension. Then you would have them try to do radial deviation and then ulnar deviation. Then we would do special tests. So the special test for the hand would include testing the integrity of the collateral joints, knowing that each of the fingers is a hinge joint that has a collateral joint, and you would test them individually as needed. One of the common injuries is called a skier's thumb or a gamekeeper's thumb, where the ulnar collateral ligament is damaged, and you would need to test the integrity of that. You would flex the thumb about 20-30 degrees, and you would apply a stress, looking to see if there's any increased translation pain compared to the other side. And you can do that for all the hinge joints. The other special test you would need to do is for the finger flexors, noting that there are two. There is the flexor digitorum profundus, which actually inserts on the distal phalanx, and there's a flexor digitorum superficialis, which inserts on the middle phalanx. To test the superficialis, you would isolate the specific joint, and you would ask the patient to flex their finger and looking for the integrity there. If you were going to test the flexor digitorum superficialis, you would hold the other digits in full extension, and you would ask the patient to flex their finger. That is testing the flexor digitorum superficialis. On the dorsal aspect, we are going to look for the integrity of the extensor tendons. There is one extensor tendon that inserts into the PIP, or the middle phalanx, and then extends down into the distal phalanx, or the DIP. To test the integrity of the extensor tendon in the DIP, you would isolate the affected joint, you would have an inflection, and you would have the patient try to extend their digit. And then likewise, to test the integrity of the PIP, or the middle phalanx, you would ask the patient to try to extend their finger on there. Finally, we want to evaluate for carpal tunnel syndrome, which is done with a Tinel's test, simply tapping the median nerve inside the carpal tunnel, or we would do a Phelan's test, where the patient has their hand in flexion and they put both hands together. And you would have them hold that there for up to 1 minute, see if they have reproduction of their pain. And then a quick screen would be thumbs up, OK sign, and then cross fingers. Perfect. Then you would do a Finkelstein test.